Thank you, Sandra, for giving me an opportunity to be part of your IC. So this is about the Childhood Cataract Project, which was supported by the US side. We're going to talk about the experience of this project we just recently concluded. So this project, the title of this project was A Step Further in Childhood Cataract. The focus was to eliminate childhood blindness due to cataract in southern India. And we focused on screening, evaluation, management, rehabilitation, and training. The duration was August 21 to April 2023, 21 months. The target was to screen 650,000 children and do 4,000 cataract surgeries, pediatric cataract surgery, and to train 1,380 pediatric healthcare providers and teachers. So the main objective was this project was to create awareness in the community, also in the medical fraternity, that there is such a thing called a pediatric cataract, and early intervention is very important. So timely diagnosis and referral is important. And this is what the main objective. So to do this, to strengthen the training among pediatricians, neonatal intensive care units, ophthalmologists, residents in ophthalmology and pediatrics, healthcare workers, optometrists, school teachers. This is mainly to diagnose the problem at a very earlier stage, and also to evaluate, provide prompt management, rehabilitation of these affected children. So we focused on, one is training, the other one is awareness. The training was mainly given to healthcare providers, educational institutes, and also other NGOs who are closely working with us. And the awareness was also done to healthcare providers like PHC workers, Anganwadi workers, and in the general community when we go for outreach programs, and NGOs about the project and the goal of the project. So this training in healthcare providers, there's a lot of awareness, lack of awareness in the medical personnel regarding the importance of early intervention. So we did this KAP study, the Knowledge, Attitude and Practices Survey, which showed that only 30% of the pediatrician or physician felt that the child is too small. They thought it was too small to undergo surgery. So we really have to, make them understand that how important to clear the visual axis and make the child see. So the early referral is very important. So we have to make them understand. And this is just a training program wherein we focused and covered pediatric ophthalmologists and pediatricians, and also focused on residents who will be, later on practitioners, the both pediatric residents and ophthalmology residents, optometrists and primary healthcare staff. And in the educational institutions, we covered school teachers. We gave them awareness lectures, showed them pictures, and then what are the basic symptoms the child presents with, Anganwadi teachers, and this is all, what we're doing, just showing pictures of that. And the emphasis was to screen these children before they go to school, or even in the school every year, have a fixed program wherein all these children will be screened once a year. The training methodology, it is not going into the details. So it was done for the pediatric ophthalmologists. We had a program for 2 weeks. Even our own trained pediatric ophthalmologists, other general ophthalmologists were doing a little bit of pediatric ophthalmology, were brought back to the hospital for 2 weeks intense program where they had a logbook where they enter the data, wet lab training, video demonstration, hands-on. They got to do a couple of surgeries of pediatric cataract also. And the other NICU pediatricians and residents, they had lectures. Either some of them we did virtually, some of them in presence, and they all got a training kit with the torchlight, Snellen's chart. And we also went to the pediatrician's clinic where we set up the vision chart so that they can do a routine screening. Some of the busy clinics, in fact, our training optometrist was there on busy days. Like Monday is a busy day, he was there, screening at least 150 to 200 children on one day in the evenings. It did not affect our work also. So that was one thing we did. And again, the same thing was done for the optometrists and PHC staff and Anganwadi teachers. So we were giving them all the training credit, following up. And we also did post-training activity by following them and reviewing them with meetings. And the awareness program was also done in the community. When we go for outreach, or even in the, in the hospital, we're giving out a lot of, meetings, and then brochures to the patient, and increase the knowledge about childhood eye diseases with the focus on congenital cataract. So this is just to showcase the different kinds of programs we did. And most importantly, I forgot to share, this was done across all the the tertiary eye care centers of Aravind, from Madurai, Tirunelveli, Pondicherry, Salem, Coimbatore, Chennai. So we were able to cover a big area of children. And then one important thing was we held the help of the NGOs, the Shanti Ashram. We had the collector was here for the Vision Day, and then we released a poster, and also we came out with eye health card. So this was part of the project. And this is the methodology I already mentioned in detail to you. So identified defective children will be referred to any of the 7 centers referred. So it was not very difficult for the patient to travel long distances. And the referral follow-up also was done, and that's how we made it complete. So this is mapped all the places where the children will be, will have more footfalls to access healthcare. Then fixed vision chart, like already mentioned, especially in the schools and in the pediatric clinics. And then awareness posters in the waiting area of vision centers, in the NICUs, where there's a lot of footfalls of young parents. And of course, COVID did have some effect on the project, but then we did online training, and the opportunity was to depute our staff for the government vaccination, which in fact helped us to get the permission processes easily. So screening at the juvenile blind school, because sometimes we all know, like Sandra mentioned this, in the blind school, all of you would know better that in the blind school there are a lot of congenital cataracts not operated, because they're not aware that by just doing a simple surgery the vision can be regained. So this is to leave no one behind. So the impact of the project across the hospitals, we almost screened 3,61,213 children, and the schools around 3,85,000, and the vision centers screened about 1,49,000, in the pediatric clinics 1,31,000. So totally around 10,42,214 children were screened, and the classes were given to 1,20,233. And the cataract operated was 2,195 during this period across all the hospitals. And we've trained almost 5,410 healthcare providers and teachers. So this is the impact of the project. So totally the numbers we were supposed to train is 1,385, but we trained 5,410. And the teachers were, 880 and almost 4,346. So which was definitely a good outcome of this project. So again, reach 2,000 people of different groups. So this will definitely give an awareness in the community, because you've trained so many people. So with this, I conclude that definitely this was a good project. I think though the numbers of cataract surgery, we're supposed to do 4,000, we did around 2,700. So we should always keep in mind that, this is the mission we have at Aravind for the pediatric ophthalmology department. We always say that the children have right to sight, and we should all strive to give it with all our might. And preventing blindness, needless blindness, is what we do with care and kindness. Thank you.